Jerry Seinfeld once said, "People's number one fear is public speaking. Number two is death." That means to the average person, if you go to a funeral, you're better off in the casket than doing the eulogy. It is true that most doctors do not enjoy public speaking. They're good with one-to-one conversations with patients. However, they're out of their comfort zone when it comes to speaking in front of other physicians, colleagues, and even lay persons. In this video, I'm going to give you the public speaking insights I've learned about how to craft the speech and what you can do to capture and hold the attention of your audience, whether that's for a pharmaceutical dinner presentation or some other occasion. Let's look at the 3 types of effective openings. Once the introducer invites you to the front of the group, what you do and say in the next 30 to 60 seconds will set the stage for your program. It is at this crucial time that you will have the audience's undivided attention. So use this time to establish your expertise as a spokesperson on the topic. After thanking the meeting planner, you can begin with a captivating statistic. For a talk on prostate cancer, you could cite 26,000 deaths each year from prostate cancer. Can you imagine 1/3 of the capacity of the New Orleans Superdome dying each year from a disease that can be detected and potentially cured with an annual rectal exam and a PSA blood test? I suggest you avoid the cliches such as, "I'm delighted to be here," unless you can make that cliche humorous. You can also use a story as an opener, a story about a patient, or better yet, a personal experience that relates to your topic is a great way of connecting with your audience and capturing their attention. Another attention-grabbing opening technique is promising the audience you will tell them how to get something they want, as it goes straight to the self-interest of the audience. I refer to this opening as tuning in to station WIIFM, or "What's in it for me?" A talk on practice productivity might begin by promising the audience they can increase their collections by $250,000 by showing how they can increase the number of patients seen by just 1 additional patient an hour. My next piece of advice is to follow Aristotle's rules for the body of the program. Nearly 2,000 years ago, Aristotle established his rule of telling the audience what you're going to discuss, making your 2 to 3 salient points, and lastly, summarizing or giving your call to action. So I begin with the goals and objectives that I want to discuss, usually limiting to 3 and no more than 4 objectives. For example, my objectives for a talk on the treatment of androgen deficiency in men with localized prostate cancer might be 1, the history of testosterone in men with prostate cancer, 2, what men qualify for androgen supplements, and 3, how to monitor the prostate cancer patient who receives hormone replacement therapy. I like to begin a clinical program with a case history. I tell about one of my patients who had the specific problem, and if it's a pharmaceutical presentation, how I use the drug to manage the patient. Let's be honest. Most medical talks are boring and very dry. Therefore, try to inject some energy and enthusiasm in the middle of the program. Every few minutes, I will tell a story or ask the audience a question. For a program on practice management, I will relate a story about an unhappy patient and then ask a doctor how she might handle the disgruntled patient. This is a nice break from the main content of your presentation and engages the audience with a more fun and interactive program. It's important to keep the audience's attention focused on you by using an occasional visual aid. It has been my observation that few physician speakers make use of visual aids during their program. Instead, the physician relies heavily on their slides, often speaking to the screen and not looking at the audience. If I am speaking about urinary incontinence, I will use a balloon to demonstrate the bladder and the urethra. By the way, I haven't figured out how to avoid the sound of flatus when I allow the balloon to be deflated. A few suggestions regarding the use of visual aids. First, keep the visual aid out of sight until you are ready to use it, so the audience isn't looking at it when they should be focused on you or your slide material. Second, make certain that your visual aids are large enough to be seen by everyone in the audience. Third, do not pass out the visual aid to the audience during your program. This will certainly take their attention off of you and your material. And lastly, when you have finished using the visual aid, put it away. It is a good idea to let the audience know you are coming to the end of your program. For a dinner program, I try to time my ending just as the entree plates are being cleared and just before the dessert is served. I then restate the 3 objectives and how they might pertain to the audience's patients and practices. Then it's time to take questions from the audience if they weren't asked during the program. So what's the bottom line? There's a lot we can do to add punch and pizzazz to our presentations. In the future video, I will discuss managing the question and answer component of the program.